Hello, my name is Sharun Daniel, and today I'll be presenting my case presentation for partial fulfillment for NST 653 oral competency exam. So here's my case. A symptom of depression, sadness, and anxiety have gotten worse in the last few weeks since she got divorced last year. The patient does not wish to discuss why they separated but mentions that she has been experiencing these symptoms for a few weeks after her divorce. Patient appetites has significantly decreased since last month, leading to an unusual weight loss. She is also suffering from sleep deprivation, which is affecting her performance at work. She only gets 2 to 3 hours of sleep per night, leaving her exhausted. As a result of the divorce, the patient no longer enjoys hiking or biking activities she used to enjoy. The patient denies being suicidal. The patient's energy level has fallen, so sometimes she cannot get up and dress up for work. Because of the patient's fear that everyone will gossip about her divorce, she is completely isolated from friends. I cannot find a way out, she states. She also mentioned that her depressive symptoms started after a couple of months of divorce. After going to a therapist to manage her depressive symptom for a few sessions, she found that therapy was not helping her. She decided to see a psych provider who recommended antidepressant alone or combined with CBT to improve her depressive symptoms. Although she is reluctant to a psychopharmacological treatment and is concerned about side effects, she is educated about the risk and the benefits of the medication and how antidepressant and CBT could effectively improve her mood symptoms. Depression is a problem of major significance and some statistics that everyone should know. The prevalence of depression is estimated to be 3.8%. Depression affects 280 million people around the world. Women are twice as likely to suffer from depression as men. Depression affects more than 10% pregnant women and new mothers worldwide. In low and middle income countries, 75% of the patients do not receive medical treatment. Mental health is underinvested, healthcare providers are undertrained, and mental disorders are stigmatized according to World Health Organization. AIDS standardized prevalence in US. Depression has been diagnosed in 1 out of 5 US adults. The most prevalent group is 18 to 24 years of age. Seniors over 65 are the lowest among the groups. The need for a mental health nurse practitioner and relevance to PMHNP practice. Providing targeted psychiatric care. Their role is to identify, screen, and monitoring of comorbid conditions. They provide patient and family education. They assess, diagnose, and treat acute illnesses. They offer psychotherapy. They could prescribe medication to treat acute and chronic illnesses. The provision of care coordination, providing referral, performing and interpreting lab tests, diagnostic studies, and they also provide the preventive care such as screening. So this is my picker question. In an adult patient diagnosed with major depressive disorder, how does antidepressant monotherapy or combination therapy compared to CBT alone affect the severity of depression by administering patient healthcare questionnaire PHQ-9 in the span of 12 weeks before and after the intervention? Here's some literature review which I have found after going through various articles and research studies, and I found that antidepressant monotherapy or in combination with CBT is more effective than CBT alone. Research gap in depression, treatment coverage. More data is needed from low and lower middle income countries. Access to care. Patients with mental illnesses may face barriers to accessing appropriate care, such as stigma, high out-of-pocket cost, and low availability of resources. Clinical research. In mental health trials, most participants being white. This limits researcher ability to identify the most effective tools for each patient. Gender. Depression rates are higher in female than male after puberty, and there is an evidence that this gap may continue throughout the life. Here's the evidence-based table for the study. So in the first study, Boschlo and the other authors was conducted in 2022, meta-analysis level 1 study with total participant number of 599. And they found that SSRIs are more effective than CBT in improving depressive symptoms. Guidi and other author has done their study in 2021. The total number of participants are 2,283. Systematic review meta-analysis level 1 study, and they found that concurrent psychotherapy CBT and antidepressant medication, when administered together after response to acute phase pharmacotherapy, reduces relapse and reoccurrence in MDD patients. Stephanie Zucker and other authors conducted a study in 2020, meta-analysis level 1 study. They reviewed 8 previous articles and found that the combination of CBT with pharmacotherapy for treatment-resistant patients shows a decrease in depressive symptoms. In 2019, another study was conducted by DeRubis and other authors, with total number of participants 292, meta-analysis level 1 study, and they found that a combination treatment with antidepressant medication and CBT is associated with better acute outcomes than either treatment modalities alone. In 2019, Dunlop and other authors has conducted randomized controlled trial level 2 study with total number of participants 112, and they found no difference in sequential efficacy, but confirmed combination therapy as more efficacious. So here's some clinical guidelines for treating depression. Number 1 guidelines: combined cognitive behavioral therapy or second generation antidepressant are recommended initial treatment for patients with moderate to severe depressive disorder. Per second guideline, as a first treatment option for mild depressive disorder, CBT is recommended. And according to the third guideline, changing the second generation antidepressant or adding another pharmacological treatment or switching to cognitive behavioral therapy or augmenting it with other treatment could be beneficial for MDD patient. Evidence-based practice clinical guidelines. Evidence-based practice is a process of reviewing, analyzing, and translating scientific evidence. The goal is to quickly incorporate the best available research, clinical experience, and patients' preferences into clinical practice. This is so nurses can make an informed patient care decisions. Evidence-based nursing draws upon critical reasoning and judgment skills through develop experience and training. Besides keeping healthcare practice relevant and current, evidence-based nursing practice offers many other benefits to us and to our patient. It promotes positive patient outcome. It reduces healthcare cost by preventing complication. It contributes to the growth of nursing science, allows new technologies into healthcare practice, increases nurses' autonomy and confidence in decision making, ensure the relevance of nursing practice with updated intervention and care protocols, provide scientifically supported research to make well-informed decisions, fosters shared decision-making with patient in care planning, enhance critical thinking, encourages lifelong learning. Nursing decision based on the evidence-based practice results in better outcome, higher satisfaction, and lower patient cost. To achieve nursing excellence, this method promotes lifelong learning and continuous quality improvement in nursing practice and clinical care. Here are some of the resources which we can use for evidence-based practice to help our patient keep safe and ourselves safe. So PMHNP advocacy role. The concept of mental health advocacy has been developed to promote the human rights of person and mental disorder to reduce stigma and discrimination. It consists of various actions aimed at changing the major structural and attitudinal barrier to achieve positive mental health outcomes in the population. PMHNP advocate for improved access to mental health services for all demographics through public health services. They also educate patients, families, and communities about mental health, which can help create a more informed and mentally healthy society. To boost community advocacy, nurse practitioner can establish a relationship with legislative professionals. Professional relationship allow NPs to communicate relevant and timely information to government decision makers regarding public welfare issues. Theoretical mental health model. I have chose Beck's model of depression for my patient suffering with MDD. This model shows that and proves that depression results from the negative automatic thoughts. So negative triad with 3 negative schemata. So negative view of the self, negative view of the world, and the negative view of the future. This model has been widely used for depression, and cognitive behavioral therapy is based on this model. PMHNP leadership roles. The role of a leader and management in psychiatric nursing is critical. Leadership affects mental health quality, team effectiveness, and directions. Mental health nurses who develop strong leadership and management skills can navigate the challenges of their work. advocate for their patient, and enable a positive change. Communication is a fundamental to psychiatric nursing. Healthcare professionals, patients, and their families need effective communication. Communication should be clear and easy to understand, and they must listen to and respond to other concerns too. Decision making is another critical skill. Leadership demands many tough decisions from psychiatric nurses. Making decisions that are in the best interest of their patient requires weighing up the pros and cons of different treatment processes. Problem solving is also essential. Nursing in mental health can be unpredictable, making nurse leader flexible and innovative. Lastly, motivating and inspiring others is crucial for leaders. Nursing leaders must inspire confidence, motivate their team, and create a supportive work environment. Ethical decision making. Ethical decision making is a process for an individual to follow to make a decision guided by ethical principles and values. It is important for decision makers in the workplace to make ethical decisions to protect different people that are working there, for them to facilitate and support every member of the team. The principle for ethical decision making for PMHNP: autonomy. This addresses self-determination, allowing the person the freedom of choice and action. Beneficence. This refers to doing good to all patients. Non-maleficence. The principle refers to not causing harm to others. Fidelity. Honoring commitment is the focus of fidelity. Fidelity includes acting with care and being honest. Justice. Justice does not mean treating everyone the same. Rather, it means treating a person in a way that meets his or her individual needs. So the steps of ethical decision making is to identify the problem, follow the code of ethics, which I'll be discussing later, determine the nature and dimension of the dilemma the patient is suffering from, generate a potential course of action, analyze all the options we have, and determine a best course of action, what's going to work best for the patient, and identify the best course of action and execute the plan, and then reassess it if the patient has got the better outcome or not. Ethical dilemma in today's practice: patient refusing treatment, provider task clashing with personal beliefs, need for parental consent in children's treatment, involvement of minors in decision making, contrasting value between providers and the patient, and the confidentiality in conflict with other ethical principles. ANA Code of Ethics. The American Nursing Association put together a code of ethics to guide nursing practice and ensure the highest standard of ethical behavior. The nurses must adhere to code of ethics to maintain professional integrity, providing safe and competent care, and build trust and confidence within the profession. ANA Code of Ethics is organized into provisions so nurses can navigate ethical dilemma throughout their careers. These Code of Ethics outlines the ethical responsibility of nurses in 9 provisions published in 2015. Provision 1. The provider's top priority is respect of each person's dignity, worth, and individual attributes. Provision 2. The provider's primary objective is individual, families, groups, community, and population. Provision 3. The providers promote, advocate for, and protect patient right, health, and safety. Provision 4. Providing optimal health care requires the nurse to act with authority, accountability, and responsibility. Provision 5. Our provider responsibilities include health and safety, maintaining character and integrity, competence, and continuing professional development. Provision 6. Providing safe, quality healthcare is a nurse's responsibility both individually and collectively. Provision 7. Through research, scholarly inquiry, standard development, and policy development, nurse advance the profession in all roles. Provision 8. Health diplomacy, health right protection, and reduce health disparities are providers' goal. Provision 9. Provider and health policy must reflect nursing values and integrate social justice principles through their professional association. Implications of Code of Ethics in PMHNP role. The Code of Ethics guides PMHNP in decision making, support PMHNP role within the healthcare system, commitment to patient well-being and professional integrity, and it also advocates with the patient interest. Cultural sensitivity. Healthcare system and provider must be culturally competent and aware of the patient perspective, considering patient preferences, values, cultural traditions, language, and socioeconomic conditions. Patient-centered care and cultural competence intersect in a meaningful way. Patient preferences, needs, and values should be respected and cared for according to their preferences, needs, and values. Improving healthcare quality requires both cultural competence and patient-centeredness. Individual care requires collaboration between providers and patients by considering diverse lifestyles, experiences, and perspectives. The use of technology for PMHNP. Technology has opened new frontiers in mental health care and data collection. Mobile devices like cell phones, smartphones, and tablets are giving the public, healthcare providers, and researchers new ways to access help, monitor progress, and increase understanding of mental well-being. Mental health apps and other technology have a lot of potential, both for people seeking mental health care and mental health professionals providing such services. While we have some pros and cons for using the technology, it's convenient, it has lower cost, it has greater outreach, it is available for 24 hours, it is consistent, and it lets people receive treatment anonymously and privately from the comfort of their home. But we also have some cons. Privacy, how does the app make a guaranteed user privacy, considering many apps deal with sensitive personal information? Audience, does the app work equally well for all age group? It meant to be? Does it work for all age group in the guidance? And how do people determine if an app is effective when no industry-wide standard exists for evaluating the quality of the app? HIPAA, Health Information Portability and Accountability Act of 1996 sets national health information use, disclosure, and protection standards. A healthcare provider is permitted to disclose information to patient's family if the patient is capable and indicates that they do not want the information disclosed. However, only if the provider perceives a serious and imminent threat to the patient health or safety. Providers must understand critical terms, HIPAA prohibitions, and allowance to facilitate effective clinical outcomes. Whether or not HIPAA covers us, following its guidelines is always a good practice. The future role of PMHNP in communities. The future holds great promise and impact for psychiatric mental health nurse practitioners. We can potentially improve the health and well-being of future generation and public mental health. Yet doing so requires a shift in ideology from the delivery of specialty-based care to primary care model based on nursing values and informed by public health approach. Making this ideological shift does not require the changes to the PMHNP standard of practice or scope, but does require the PMHNP to engage in a collaborative relationship and integrate many basic and advanced competencies. An expanded scope of practice can also encourage this revisioning of the role. Educators, students, clinicians from other disciplines, policymakers, and even children and family must advocate for change. Research gaps. Research gaps indicate a lack of existing research in a field resulting in unanswered question or unresolved problem. They can also arise when there is already quite a bit of existing research, but the results contradict each other, making it challenging to draw a firm conclusion. It occurs when there's a new concept or phenomena that's not well studied. A disagreement gap occurs when existing research contradicts finding regarding a specific research question or a set of questions. Contextual gap occurs when there is a decent body of research on a topic, but none on a particular context. The methodological gap. The methodology or design of existing study contributes to this type of research gap. It suggests that existing studies are lacking in some ways in their methodology or perspective. Gaps in clinical practice. We also have gaps in clinical practice such as the poverty gap, cultural and racial underrepresentation in mental health field, racism, stigmatism, and criminal justice over the treatment options. Quality improvement initiative for depression. Underdiagnosed and undertreated depression is associated with poor health outcome and increased medical cost. The management of chronic condition like depression has become an integral part of quality improvement as healthcare delivery systems take on risk-based contracts and focus on patient health population. The problem adaptation therapy or PATH treatment is intended for older adults with major depression, cognitive impairment, and disability. The efficacy of antidepressant and psychosocial intervention in this population is limited. This PATH program was officially launched in November 2016 and was designed to deliver remote care management services and performed the core functions such as identification of eligible patients, newly diagnosed patient in primary care, and an elevated PHQ-9 score within 30 days. The regular chart review of identified patient to evaluate treatment process and the progress, and then facilitation of the patient engagement and follow-up. Outreach to primary care teams to encourage further patient contact, and remote monitoring of PHQ scores throughout a designated follow-up period to assess how well the patient has performed after getting their treatment. So patient-centered care nurse practitioner competencies. Advocacy. Psychiatric mental health nurse practitioner advocate for improved access to mental health services to all demographics through public health services. They also educate patients, families, and communities about mental health, which can help create a more informed and mentally healthy society. Vulnerable population. Nurse practitioners should educate patients on treatment plans, medication administration, and preventive care. Furthermore, nurse practitioners should advocate at the state, national, and local level for resources that support the wellness of underserved communities or vulnerable population. Respect for patient preferences, values, and needs. Patient values and preferences must be respected and addressed to ensure patients receive the highest quality of care. Cultural sensitivities and cultural consideration. A cultural sensitivity approach involves recognizing, respecting, and incorporating our patients' beliefs, values, and practices into our care plan. Considering cultural consideration help us avoid misunderstanding, miscommunication, and compromised patient care. Holism. A holistic approach to patient mental health focus on a whole person, mentally, emotionally, physically, spiritually, and socially, and not just their disease symptoms. Management strategies for patients and families. Education is a powerful tool in mental health care. Psychiatric nurse practitioners equip patients and their families with the knowledge they need to make informed decisions and manage their condition effectively. Diagnosis and treating strategies. Psych nurse practitioners are responsible for providing accurate diagnosis to mental health condition. To formulate or precise diagnosis, practitioner must listen attentively, ask the right question, and utilize their clinical acumen. Our role includes designing treatment plans. A psychiatric nurse practitioner must provide individualized treatment plans, including therapies, medical management, and lifestyle recommendations. Care plan and implication of advanced nurse practice. The care plan can help psych nurse practitioner organize and prioritize care activities and provide confidence that the patient needs are being met. It can also be guided to an action, a contract between the patient and provider, or a medical record. Identification of health resources utilization and consultation. Implement the role of a nurse practitioner based on a scientific theory. Performs a variety of roles including healthcare providers, coordinators, consultant, educator, coach, advocate, administrator, researcher, and leaders. Educate the public, legislator, and policymaker about nurse practitioner. Interprofessional collaboration and communication. To ensure holistic care of their patient, psychiatric nurse practitioner work alongside psychologists, therapists, social workers, and physicians. These diverse perspectives result in comprehensive and effective results for our patient. Clarity of role. Using principles and values of treatment dynamic, we should be able to perform effectively in different team roles, providing quality care through communication. It is an intraprofessional healthcare setting. We should recognize the difference between the various roles. Relationship community. We aim to contribute to a diverse and inclusive healthcare system by collaborating with intraprofessional stakeholders such as individual, communities, integrated health team, and policymaker. Quality and safety. Using transitional and improvement scientific methodologies, nurse practitioner promotes quality and safety for providers, patients, population, and system. Quality improvement principles should be used to evaluate quality and outcomes. Keeping national safety guidelines is essential. The goal should always be to identify area for improvement and improve patient outcome. So here's the summary. After reviewing all the articles and research studies, I've concluded that the combination antidepressant with CBT can help my patient AA. The combination therapy will, however, be followed. So here are some of the references which I have included for my presentation. Thank you so much.